Today we're going to talk about some of the unique features of the CASIO camera for basal cell carcinomas. To understand and utilize some of these unique features of the camera, you need to download the CASIO software. This software allows the enhancement of the structures and vascular features of an image, and it provides important information for diagnostic purposes. So here we have this subtle lesion of the alar groove. Little scaly, slightly raised, but clinically you can make a diagnosis. Dermoscopically, however, what you see here are these vessels which are serpentine, somewhat of a milky area, perhaps a little erosion, but not a definitive diagnosis. But I would biopsy this to consider ruling out a basal cell carcinoma. With the vascular enhancer, it's quite dramatic, and one sees clearly these serpentine branch vessels, which is characteristic of a basal cell. We see these serpentine vessels with the vascular and structural enhancer as well. We see these vessels not as well in the near ultraviolet light, but in the near ultraviolet light with the vascular enhancer, again you see these serpentine or arborizing branch vessels, characteristic of a basal cell carcinoma. And in the near ultraviolet light with the structural enhancer, we see the same features. In this subtle case, it's a slightly raised area. Clinically, one cannot make a diagnosis. Dermoscopically, it has this milky white area. The vessels are quite thin. It's not a definite basal cell, certainly would be in the differential, and I would probably biopsy this not knowing what it is. But with the vascular enhancer, we see these serpentine vessels, this milky white area. With the structural enhancer, we see the same. In the near ultraviolet light, you don't see it particularly well, but the near ultraviolet light with the vascular enhancer, you see it slightly better. In the near ultraviolet light with the structural enhancer, you see it quite well. So by using these various softwares, you're able to make a better definitive diagnosis, in this case, a basal cell carcinoma. Crusted, eroded area, not an easy diagnosis. Dermoscopically, an area of ulceration, a milky white area. With the vascular enhancer, you see some of these vessels which are more prominent and serpentine. This reddish area is the erosion leading to an ulceration. And you can see the serpentine vessels at the periphery with this crusted, eroded area and this milky white appearance. In the near ultraviolet light, they appear black, these areas of ulceration. With the vascular enhancer, not much help. And in the near ultraviolet light, not particularly helpful as well. So for this particular case, it's better in the polarized mode with the vascular and structural enhancers. Lesion on the scalp. Could this be a cyst? Well, dermoscopically, you have these very fine vessels in this milky white area. Not an easy diagnosis. With the vascular enhancer, you see them somewhat more prominently. And with the structural enhancer, you see them even better. In the near ultraviolet light, it's actually seen best, as well as the near ultraviolet light with the vascular enhancer. In the near ultraviolet light with the structural enhancer, it's equally as good. So this diagnosis is best made in the near ultraviolet light mode. Another subtle lesion. These are difficult lesions clinically. Dermoscopically, all you really see are areas of pink and white and perhaps some blotches. In the vascular mode, we see these serpentine vessels, and we see the same with the structural enhancer. In the near ultraviolet light, you see these vessels clearly, even better with the vascular enhancer, as well as the structural enhancer. For this particular lesion, pink papule, it could be anything. It could be a basal cell, but it could also be lichen planus-like keratosis and inflamed seborrheic keratosis. Dermoscopically, though, it has this one vessel, which is serpentine with this milky white area, certainly suggestive of a basal cell. Much better seen with the vascular enhancer, as well as the structural enhancer. In the near ultraviolet mode, it's not easily seen. Seen better in the near ultraviolet light with the vascular enhancer, as well as the structural enhancer. This particular case, again, another pink papule. Here we see this milky white area, as well as these fine vessels. We see them more prominently with the vascular enhancer and the structural enhancer. Beautifully seen in near ultraviolet light with the structural enhancer and the vascular enhancers. So both the structural and vascular enhancers, you see them quite beautifully, and you're able to make your diagnosis much easier because of these unique features which the CASIO camera allows you. Final case is this particular lesion, whitish area with perhaps some vessels clinically of the right alar rim, tough area. Dermoscopically, though, you're starting to see some of the serpentine vessels. Here you see them quite nicely with the vascular enhancer, with the structural enhancer. In the near ultraviolet light mode, you see them not as well as in the polarized mode, but when you add the vascular enhancer, they're quite prominent, as well as with the structural enhancer. So these unique features really make a difference using the vascular and structural enhancers. Last final case, this papule of the ear. We see here these serpentine vessels, here with the vascular enhancer, the structural enhancer, beautiful vessels, the near ultraviolet light with the vascular enhancer and structural enhancer.